joining us for this video presentation. My name is Dr. Dan Moskowitz. I'm an ENT physician affiliated with ENT and Allergy Associates in White Plains, New York. Today I want to discuss laser turbinectomy. It's a procedure that we do in the office for chronic nasal obstruction. The nasal turbinates are the nasal membranes that warm, humidify, filter the air that we breathe. And as with anything that's too good a thing, if you have too much, then it causes a problem. The causes of hypertrophic turbinates or swollen nasal membranes most commonly are allergy. It could be nasal irritants, chronic sinus problems, or overuse of nasal medications such as nasal sprays. The swollen membranes cause issues such as chronic nasal congestion, where people have trouble smelling. It can cause sinus headaches, pressure around the face. It can cause recurrent sinus infections. Some people have snoring, and it can even cause mild sleep apnea, obstructive sleep apnea. So the way we treat the hypertrophic turbinates or these swollen membranes are either medical or surgical. We always try the medical treatments first. So we target the medical treatments based on what the condition is causing the problem. For example, if it is allergy, we treat the patient with antihistamines or nasal sprays, sometimes nasal allergy shots. If the condition is overuse of nasal sprays, we'll stop the nasal spray. If it is a chronic sinus problem, we'll administer antibiotics. Now, if the patient does not respond adequately to the medical therapy, or if they do not want to be dependent on the medical therapy long term, we offer surgical options. The surgical options for turbinectomy consist of a hospital-based procedure and office-based procedures. The hospital-based procedures are done under a general anesthetic. They are really done only if there is other associated conditions causing nasal obstruction or sinus problems, such as a deviated septum or sinus surgery, which you can't really do effectively in the office. So if the condition is primarily nasal swelling, swollen nasal turbinates, then we do it in the office. And there are various office turbinectomy procedures that can be done. The one that I prefer is a laser turbinectomy, where we reduce the swelling of the membranes utilizing a carbon dioxide CO2 laser. And the reasons that I like the laser turbinectomy are threefold. Number one, it is highly effective. Studies have shown that 80% of the patients who undergo the procedure have long-term improvement of their nasal blockage. Number two, there are virtually no complications with the procedure. I have, in 25 years of doing the procedure, not had to give any patient an antibiotic or a pain medication, nor have I had any problems with bleeding after the procedure. So we go ahead and do the laser turbinectomy and proceed in the office. The procedure is done, as you can see here, in the exam room after placing the patient in the exam seat and administering topical anesthetic, lidocaine anesthetic, after which we inject local anesthetic, local lidocaine, which completely numbs the nasal cavity and the nasal membranes. Then after waiting several minutes, we take the CO2 laser and place, this is the laser right here, we take the probe from the laser and put it in the nasal cavity, and then vaporize the membranes just as I show here on each side. The procedure takes a total of about 15 minutes to perform. There is no pain at all during the procedure, and the patient is discharged right after the procedure. There are no restrictions for the patient after the procedure, and there's no downtime. So I've had patients who literally have come in lunchtime, have the procedure, and then they go back to work. So in summary, the laser turbinectomy procedure is a very safe, effective procedure for chronic nasal obstruction. Thank you very much for joining us today.